Some of our patients will come in with problems affecting the hip and pelvis, and a lot of people will be very worried that they're heading straight for a hip replacement. But very often they aren't. Very often the problems are not to do with arthritic change in the hip, but to do with soft tissue damage and soft tissue strain. So when we've taken a history and examined and made a diagnosis, we can then often help improve function of the hip with stretching and manipulative techniques. Injuries affecting the pelvis may be muscular, affecting the muscles that travel up here and join on the front of the hip. And we also see some patients coming in with inflammation at the front of the hip to do with the bursa being inflamed. That's a condition we can treat. And during pregnancy, it's very common for these joints at the back of the pelvis to be susceptible to injury, and very often because during pregnancy these sacroiliac joints become very mobile and they can quite easily just move slightly and lock and cause a lot of pain. Also at the front of the pelvis, the joint here can be susceptible to strain during pregnancy, and these are both areas that we treat and help to alleviate symptoms. Some people coming in will have the early stages of osteoarthritis in the hip, and for a lot of people that process will carry on over many years, often decades, and in the early stages osteopathy can be very helpful at improving general quality of movement in the hip and alleviating stiffness in the muscles. And very often just getting a hip moving when it's got some minor level of wear and tear, just getting the joint moving passively really helps to improve a patient's sense of well-being, improve the mobility of the hip, and also the muscles at the back of the hip, both in early arthritis and in a lot of overuse muscle injuries. The muscles that travel across here can get very, very tight. So we do a lot of work on all the musculature of the pelvis to improve function of all the joints. Some patients coming in for osteopathic treatment may actually have a condition that we need to refer on for orthopaedic help. And one of the advantages of having osteopathic treatment is that we do have a lot of time to spend with our patients. So that gives us a lot of time to find out about what's going on with their health, what's going on with their joints. And as part of making that diagnosis, we can be in a good position to know when it's our area of expertise and when it's gone beyond the level that the osteopath can treat. So we have a good network of orthopaedic consultants that we can refer to if necessary. For example, with the hip, there are certain soft tissue conditions now that respond beautifully to minimally invasive surgery. For example, this is a hip socket, and there's a lovely ligament that runs around the edge here. Now, that can get damaged, and until recently that was an injury that really there wasn't a lot that could be done for it. But now that ligament, if that gets torn, can be stitched and repaired, and even elite athletes who suffer that injury can return to a high level of performance without any problems. So referring patients on for help elsewhere, whether it's back to their GP or via their GP to a consultant, is something that our patients can benefit from.